Start.
Okay. Today we have a patient. Patient is diagnosed with fibroids. When patient is diagnosed with fibroids, we will check which level or which stage of fibroids it is, which muscle or which muscle of endometrium it is involved. We have to check this, and we have to go for surgery. Generally, patients when presents with the fibroids involving less than 50% of intramural muscle, we will go for hysteroscopic myomectomy to remove this fibroid. Actually, hysteroscopic myomectomy is also an indication when patient having adenomyosis and also fibroids and also polyps. So the procedure of hysteroscopic myomectomy is we have to go via vagina, and we have to first dilate the uterus by giving around of 2 liters of fluid in fluid which is non-electrolytic fluid, and which have to be bipolar, and we have to give 2 liters of fluid into her uterus to dilate the uterus, and that fluid is glycine or a salted water, and we will dilate this uterus and we will perform this surgery. And when we have to do hysteroscopic myomectomy, first we have to prepare the patient preoperatively, intraoperatively and postoperatively. We have to keep the blood ready because there is a chance of losing blood in this condition. And in pre-operation we have to give GnRH analogs plus iron to the patient to increase the hemoglobin levels in patient, and they have to give vasopressins to dilate this uterus, and we also give anesthesia during intraoperation period. And there is a complication of adhesions and more bleeding in cases of hysteroscopic myomectomy. So we have to keep the blood ready at every time, and it is removal of muscles of endometrial layers. Generally, we do this hysteroscopic myomectomy in cases of fibroids when it is stage 1 and stage 2, also in 0 stage, when the sizes of fibroids are less than 3 centimeters. And generally, if not hysteroscopic myomectomy, we can also perform laparoscopic myomectomy, which is of when the fibroids involving 5th, 6th types of sub-serous of layers. Then we have to go for laparoscopic hysteroscopic myomectomy. And first we used 2 liters of fluid to dilate the uterus. So after operation we have to check how much fluid is coming out. When we aspirate the fluid, we have to check how much fluid is coming out. We gave 2 liters, and if we get back at least of 1.8 liters, then it is normal. But sometimes the fluid loses in the abdominal cavity itself. This will cause overload of fluid overload in patient's abdomen. This will cause cerebral edema, pulmonary edema, and chances of cardiac failure will be there. And there will be hyponatremia, low level of sodium, and patient may also die due to fluid overloss. And after operation, we also keep in mind that there will be chance of more bleeding, so we have to keep the clamps readily to ligate the uterine artery, because the uterine artery is going to bleed in such cases. Yes, this is about hysteroscopic myomectomy as well as laparoscopic hysteromyomectomy. We use such operations in cases of fibroids, polyps as well as adenomyosis.